Language and communication is something that can really influence how a family views and understands their child's condition and prognosis. This is, of course, a sensitive time of heightened emotion, and information needs to be factual and correct, but always delivered in a compassionate and delicate way. Words mean so much to these parents, and they can have a profound effect on them, as was the case for Sarah and Ben, parents to baby Hannah.
My name is Sarah Spoelstra, and this is my husband, Ben. And we had our first daughter, our first child, in June of this year. And she was diagnosed with anencephaly when we were about 14 weeks pregnant. I remember it sticking totally in my mind when we were at the ultrasound, where we got the diagnosis. I remember like everything kind of, once you hear like bad news, your brain just kind of like shuts off and you don't even hear what the doctor's saying. But I just remember hearing one word, and that word was lethal. Yeah. And I lost it. And like that word just like burns into my memory. We just needed someone to talk to. Mm-hmm. We needed someone who was compassionate, but yet knowledgeable, professional, but that we could just simply talk to and ask questions with.
Mm-hmm. I think that was probably what was most refreshing about when we sat in this very room talking to Dr. Perinatal for the first time was she focused on what Hannah's life was going to be like. You know, like we already knew what the end was going to be, but she was more concerned with the short time that Hannah was with us. What is her life going to be like? Is she going to be comfortable? What kind of memories do you want to make with her?
And even just something as simple as referring to her as our baby, our daughter, Hannah by name. Like a lot of the other doctors, like, you know, once they know that your baby's not going to live, it's like not a baby anymore to them.
Right.
The language is very, very, very important. A parent who is expecting a baby with a life-limiting condition is destroyed by the news, and is afraid to think about that the baby with such a condition will be born. And so it's very important for us as a professional to support the parents in welcoming this baby. But the situation here is so hard that it's almost I want to say impossible for them to embrace that baby at that moment. It's very, very difficult. And so the language we use as we enter a relationship with them to counsel them is always asking, is a baby boy, is a baby girl, did you give a name already? We explain about other story with other babies with similar condition. We want to communicate that we do care for that baby. That's our mission. We are in medicine in order to help a patient. So our goal is there to help them, but even before them, to help this baby to get the best possible from his or her life.
So I feel that language is very important and also expresses what the professional thinks. So it is not just by the words, but also by how you look at the person, how you stay in front of them, but also words, they remember these words for the rest of their life. And like saying little, for instance, or not viable, that's not really true. It is one of the things I've heard most times coming from people coming from other places, that they say, finally, there's someone who cares for my baby. And they perceive very clearly the difference.
The use of terms like incompatible with life or lethal, I think they are wrong, they are false, because this baby is going to be born and this baby is going to live. Now it's going to be living for a short time, but there is a life there. And so those expressions, they don't reflect the reality. Secondly, they are very harsh towards the parents. You know, when you communicate to parents during pregnancy, you have to be respectful of the fact that this is their baby. They love them. And so use an expression like lethal, incompatible with life is also very, very harsh on them, and taking away the hope of the fact that they will see their baby alive maybe for a few minutes. But I think the first reason is really scientific. There is life there is a baby who's growing, a baby who's going to be born, a baby who's going to breathe for a short period of time. So I think life-limiting condition is the best definition.